By 88.7 FM that features interviews and discussions on community issues in Central Texas for teens by teens. I'm Riley, your host, and today we have a special guest, Dr. Larry Wallace. Dr. Wallace goes above and beyond in serving the greater Austin community through a number of different roles, making history as the first Black mayor of Manor and co-author of The Transition, Preparing for Financial Combat. He's also the co-founder of Black Men's Mental Health Clinic, and Dr. Wallace beyond his business and civic leadership, Dr. Wallace serves on a number of boards focused on health, publication, public health, education, housing, and equity. Dr. Wallace, your continuous work to advocate for the greater Austin community is admirable and increasingly important. To begin, I'd like to focus on your work in public health. As you're likely aware, Black men remain an underserved group in the healthcare world, and this makes Black men more vulnerable to health issues and emergencies. When did you first become aware of these issues, and what sparked your passion to take it on?
Well, first and foremost, appreciate the opportunity to be able to be here and talking with you and everybody else that's in the room right now. My involvement within the healthcare space, I would say initially on was at a distance. My father has always been in the healthcare space. My mother was a radiation therapist. So it was always a thing of going to their jobs, seeing and meeting the people that they're working with, operating with. And I think how I got more involved in the healthcare space was when my father was thinking about launching the Black Men's Health Clinic. At that time, I was coming out of the seat as mayor for the city of Manor. I was doing my exploratory committee for congressional race, District 10 against McCain, and was supporting where I possibly could with the available time that I had, and got more involved as things really started taking off for him, and wanted to ensure that all of the support that he gave me during my time in the military, being deployed and overseas, and every time I made the phone calls, he would step out of a meeting and take the phone call, right? He would, anytime I take command in NATO, go to some type of graduation or whatever, he would fly overseas and be present. And so for me, it was very important to support his vision and make sure that through his ups and downs, right, that if it wasn't successful, it wasn't because I was too busy. And through that, and like anything in life, sometimes you don't naturally see yourself going into a particular space. You see yourself helping a friend, you see yourself being asked to support, and you find that you may have a knack for it. You may find that you can be a supporter in it. And I think that's really what happened. And as I became more knowledgeable, and I kind of already had a cheat sheet of how the system kind of worked, from him being a co-creator of Central Health and Community Care and Dell Medical School and Sendero Health Plans, there was a lot that I could already kind of lean on, and individuals that I kind of knew from his time, but also my time as mayor, that really enabled us to be successful so far.
That's wonderful. Can you tell us a little bit more about what the Black Men's Health Clinic does and who you guys serve?
Yeah, so the Black Men's Health Clinic is really focused in coordinating and navigating health services. We've intentionally focused on partnering and collaborating mutually with the public health system. So you're talking about organizations that are really focused on low to no income, marginalized populations. We have a lot of individuals that will say, hey, I haven't heard about you. Like, well, that's because of who we're focused on. If you have money, you can pick where you want to go. Mm-hmm. When you don't have money, then 9 times out of 10, the only resource you have is the public health system. And we're all funding into the public health system. If we keep creating other clinics and other resources because we don't like the one that we're funding, then we are funding one thing that's not working, and we're creating something else that we have to pay for. And so we've intentionally partnered with the public health system and said, there's a lot of things you just can't do. Let us be the coordination, navigation, and be very unapologetic in our approach, meaning more culturally specific, right? In a way that you can't do. And through the partnership and the collaboration with us, we can be that extension. We have a joint clinic with community care. We have a joint person with integral care, the local mental health authority. And so we're saying, in this sense, don't worry about trying to build the trust. We know that you are the clinical piece. Let us lean on your clinical expertise, and you lean on our outreach and engagement efficiency, and let the two mutually combined. And as we start to grow greater trust and get more information back, then you're able to tailor and modify your clinical services, because now you're getting input you normally wouldn't. And I think another summary to this is we have a lot of reports that are City of Austin or the county, and those reports and surveys come from the patients that they see, come from the focus groups that show up. What about all the people that don't? There's so many people that need services that don't come for the $20 gift card, that don't come for the food, right? How are you engaging with them and finding out why they're not coming, right? So you're building a system based off of 50%, 75% of the information, when the ones that need it the most are the ones that are not showing up regardless.
Yeah, I think that's really impactful what you said about trust. Can you maybe tell me a story or give me an example about when you really felt the impact of your work on the communities that you serve?
I'm going to have to share someone else's story, because I am not working day in, day out with all the clients, right? Our team is. And they're doing an exceptional job. And I know that now, going 3 years in, providing services, we're still morphing and designing and structurizing it, that they're dealing with that, and they're putting their hearts into who they're engaging with. We've had individuals, I think even now with the extension of the partnership with Community First Village, where there's been individuals that haven't wanted to utilize the services locally there. But somehow we've connected with them, and they're wanting to use the same resources, but through our door. And by having that different engagement, they're being more receptive of utilizing the same provider that's closer to them, because of that connection, because of that referral. And then they're now saying word of mouth, right? More than just spending money in marketing, is word of mouth, like selling lemonade, right? I can tell you how great my lemonade is, but once you buy it and taste it, there's nothing I can do about it. You either like it or you don't like it. And so you're seeing this word of mouth happening at Community First Village because of the time that is being spent on getting to know the person. I can have money all day long and have a clinic across the street and still not go, knowing I need to go. You need to find out why I'm not going. It's not always about access. Sometimes it's about the humanistic person, why they don't want to go, even when they have the access.
Yeah, I think what you said about figuring out why people don't want to go is really important, and actually a great transition. So I was researching medical mistrust a little bit more in preparation for this interview, and I found an article from the National Library of Medicine, and it stated that Black men are far less likely to access healthcare than white men or any group of women. It also found that Black men are 75% less likely to have healthcare insurance than white men. What do you think are the factors that are creating this disparity in care and reaching out?
You'll have the one crew that'll talk about Tuskegee and everything else that's going on. I'm a person that likes to use examples a lot. You heard that when it came COVID and so forth. I mean, that has its truths, but it's not the linchpin of all truths, right? Some of it is historical in how we bring up our own kids, right? How often are we taking them to be seen? How are we messaging being seen? A good example would be, as a veteran, I hate when people message and say, identify that you're a veteran because you probably need some help. How about identify that you're a veteran so you know all the services that are available to you that others don't have? Oh, and by the way, if you happen to need this and you happen to need that, let me get you connected. I'm not going to say it to, put it to everyone, but normally, we're viewing seeking health services in a negative connotation, a negative sense, more than a way of strengthening, being able to overcome, being able to set yourself up for success, right? And then the other aspect is, we're not teaching folks how to leverage such resources to build legacy wealth or to build a professional career, meaning by taking care of your mental health, by taking care of your resiliency, you'll be able to overcome these things. You'll be ready for the boardroom. You'll be ready for these stressors that come in these higher positions that you don't know. I could tell you all day long, kind of like pledging Alpha Phi Alpha. I could tell you all day long what it's going to feel like to catch that wood, right? I could tell you all day long. But until it happens, you don't know how to manage it.
Mm-hmm. I think that what you're saying about like how we discuss health in the Black community and having that open dialogue is really important. I was wondering if you could give us some ideas or tips or advice on how to start that dialogue within our own families.
It really boils down to the sense of not bringing your assumptions to someone else. And it was really reinforced this week. I just got done doing peer support training, mental health peer support training, and a lot of it was just a refresher of stuff I even learned in the military, which was you have to understand the other person. Just because you may be trained, just because you may have lived experience, your environmental circumstances, no matter how similar, are still different. Very much like writing a resume, right? Just because you and I had same position, same organization, same roles and responsibilities, how I think is different than how you think, right? Mm-hmm. And that's the key piece. No matter how much similarity there may be, I still don't know how you think, right? And until I understand that, then I really can't have a true conversation to help you realize from your own self-awareness what other options may have been viable so that you hopefully make wiser decisions, more informed decisions going forward. I can tell you all day long, course A, course B, course C. But if you don't see them, you don't know how to create those courses in your own mind, then you're always going to be looking for someone to tell you what to do. Mm-hmm. And when it doesn't work out, they're the first person you're going to blame for it not working out.
Yeah. So can you tell us a little bit more about like how you see women impacting Black men's health, or do you see women bringing Black men to your clinic, or how you guys may service women, if you do, if you don't?
So we have exceptional ladies working with us. Our navigation manager, Dominique Holman, she's a joint position between us and community care, exceptional. Jackie Oviedo, she dual language. She is now taking over our partnership program, SOAR, working in the unhoused space. Amazing, exceptional lady. Toya Craney, managing unhoused. She was our first unhoused person overseeing stuff, along with Kimberly Holiday, who is the mayor pro tem for Pflugerville. They're doing some great work in the unhoused space. And I got our marketing person, Felicia Chandler. She was been with us from the beginning. So all those imagery you see, that's her. We got Pamela Parker. She's our communications person. So the special announcements and so forth, that's her. So very embedded, from board level, advisory committee level, to leadership level, to engaging and operating on a navigation coordination space. So it's more about, do you have the right mentality of what we're trying to do? Less about gender, less about background, and less about, what credentials and all that you have. Do you have the passion? Because all the rest can be taught or earned.
Yeah. And how do you guys find most of your clients? Where do they tend to come from? How do they find y'all?
So again, we really work on word of mouth. We started out doing a lot of tabling, going to a lot of fairs and events. I would say for any organization, that's the awareness phase. Now we switched and shifted to more business term here, B2B, business to business. So Community First Village, Sunrise Navigation Home Center, Housing Authority, Travis County, organizations that already have a population of individuals that they're serving, right? That more social determinative health piece, right? The other aspects that are not medical. And because they're supporting in food, or they're supporting in housing, they're supporting people from reentry coming out of jail, there is a health component that's needed, but that's not their space. Mm-hmm. And it requires so much to be able to provide medical coordination, right? Because I can do a referral, but if I'm not medical, I can't be a part of that journey. I got to do a handoff, and I can't follow up on it. So we serve and want to serve as that component, as that piece of the pie within their organization, so they can focus on their area of expertise, and then we're bringing in ours, and it's more of a mutual partnership in that sense. And back to your other question, so that's why we changed from just men of color to men of color, their immediate families, and those with extenuating circumstance. So we do support where we can ladies and children and so forth through our care network, which is more than just medical. So there's some aspects we're limited in the medical, but we try to do those partnerships so we can do warm handoffs to partners that understand who our clients are that are coming to us.
Yeah. So I know that your clinic is more on the logistical side, but I'm wondering, when you see these cases come day in and day out, and how that could be difficult on your own mental health and mental well-being, or your staff's. And I was wondering how you guys handle seeing all these cases day in and day out.
Very interestingly, our navigation manager, Dominique, had brought that up a couple weeks ago. And then my father, Dr. Larry Wallace Sr., he brought that up again last night when the kids were having their football games, and discussing, what is viable in and above the resources that are there, right? Because just like teachers, just like first responders, there's a lot of resources that are available. Now, there's a component of it's on that individual to access those resources. But then there's the aspect too, which is, if that's not enough, what else can you be able to do within the structure of your organization? A lot of our individuals are contract versus employees. So there's some things that are not established because they're not employees, where you would have sick days or mental health days and so forth, because in contract it's kind of more of, if you're not working, right, then you're not supposed to get the pay for the time you're not working. So we're looking into what can be viable. How do we do something where it's requesting to load or make up those hours at a different time? But again, if that's just, I'm making up the hours. So am I really getting a break, a mental break, if I'm taking a day or two off, and then I got to make that day or two up in the next couple of weeks to be able to still get my overall pay for the year? So we're still even looking into those aspects. But again, it'll be a mutual conversation between board, advisory, and the team members. Okay.
So as a veteran, you understand the difficulties and transitioning from military life to civilian life. You wrote a book on it. I have an uncle who was a Marine, and when he ended his career due to medical issues, he was able to transition into a job with the federal government helping other veterans. But I know that this transition isn't always easy and smooth. So can you tell us a little bit more about the shortcomings in the healthcare systems for veterans and what we can do to help fill them, or what you guys do to help fill them?
Interesting question. It brings me to a lot of potential responses because it's making me think of my time, especially here with Mr. Hopton Hay, my time at University of Texas System when I was the director of veteran support and leadership programs. And we looked at that. I think just in general, right? One, I could say university campuses have multiple different health resources, but they're never connected, especially for veterans. Two, veterans are very similar to the sports population, the 1%ers. There's only 1% at any given time that are actually serving or actually playing. So there's only 1% at any given time that fully understands what that individual is going through. And then they call it the green suitor or the uniform analogy, which is then only maybe another 14%, 20% even have an idea of what you've gone through, right? So even if I need to look for something psychologically, mental health, behavioral health, if I've never been in that uniform, then I don't even really understand the stressors, right? I can only go off of the black and white of the textbook. I can't think into the gray area. So then there's that piece of how are you going to try to help fix me, not fix me, but how are you going to help me go through my journey? And you can't even first understand or relate to my journey. And there's not that many people that can, because there's only 1%, right? So that makes it even more difficult. So then you're talking about now shifting it over. When I'm going through my transition, what most people know and what most people see is what they see on TV, the movies, what they read. So now you're getting a skewed understanding of what my profession is, right? Then you're hearing about the more negative aspects. You hear about so many veterans or PTSD, so many sports folks and this and that. There's more regular individuals that have PTSD than combat veterans that have PTSD. You could have a car wreck. You could have a shot go off. You got PTSD. So compare that against the normal population compared to what the actual population of designated PTSD is in the military. So there's skewed numbers in misperception, right? And then you're looking at the fact of if I have benefits and I'm trying to use my resources in the health space, most organizations are only seeing the check that can be paid through the VA system, right? So then I get cookie cutter approaches. And so when you're talking about how do you take care of and how do we want to take care of the veteran space, knowing that Dr. Larry Wallace Sr. is a Vietnam veteran, I'm an Iraqi veteran. We have a 3-star general that's on our board, and Sergeant Major, Command Sergeant Major that was in charge of creating education for U.S. Army Sergeant Major's Academy. And so we're really looking at, again, the tone, the messaging. How are we talking to someone and saying, what was your experience? And then let me acknowledge your rank. Let me acknowledge what you've gone through. And so that way you feel as if you're appreciated. And hopefully you're able to be more expressive of what kind of services and things you need. But at the same time, let me figure out what you need and then pair it to you versus you're eligible for this, you're eligible for that, you're eligible for that, right? Now, sports-wise, and I know this is a long-winded response. Sports-wise, the issue you have there, and I learned this when I was working and connecting with the NBA and elite rugby and the Olympics and so forth with my role at UT, which was, and it's very similar to the military, I'm paying you to do your job. I'm not paying you to leave. So Olympics, they only have like a 2-day exit process.
Wow.
The NFL only has like a 1 week or 2 exit process, right? And so again, it just goes back to it is I'm paying you to be successful in your job. I'm not paying you to go back to be a civilian, right? And that's where the huge gap is, because in the civilian world it's saying you got all these resources and you have all these benefits and you have all these things that the military is paying for, or you became a professional athlete that you have this and this and this. Why should I have to fill the gap?
Wow, that was a really powerful message, and I think I'm gonna have to take that one back home with me. So, I know we talked a little bit more about how we can discuss healthcare in our communities and families. I know I talked to some Black male teens recently about how we talk about health, and what was expressed to me is we talk about health a lot from a cosmetic standpoint, and that kind of can create a barrier in comfortability and what we can express, and talking about health conditions in our families and what to look out for and how to stay active and healthy. And I was wondering, how do you think we can better express our health concerns and goals?
Oh, how can we better express our healthcare concerns and goals? Going through my own health awareness, right? I had to find someone that was willing to have the conversation with me. And when I mean willing, it was like a lot of times we ask things just to check the pulse of someone else.
Mm-hmm.
And if they don't seem like they want to go down that road, then we kind of let's humor it off, right? Like, I was just asking, just wanted to know. But if they're willing to go down that road, that may be the person that opens up the door of a real conversation. And Susan Lewis was that person. She's now the veteran, the Travis County Veteran Service Officer. And when I talked to her, and I was just talking about, hey, I want to be able to have better engagements with my family. I don't feel like I'm having the same engagements that I do in my different roles and hats when there's a defined expectation of how I'm supposed to act. And through conversations with her, she had me basically go then talk to Jason Forner, the former CEO for Community Care. And Jason was like, I got a doctor that I trust. Let me connect you with him. I went to go see the doctor, and the doctor had the conversations with me. And again, it was like, hey, if you don't want to have this conversation, cool. But do you feel like this? Do you feel like that? And he's like, all right, would you be open to trying some medication and so forth? And when I got medication, then it was like, all right, I want to hide taking medication, but, how do I have a conversation with the wife? And then my mom, and then my dad, right? And then I had the conversation, and they're like, okay, cool. So, yeah.
Okay, well, thank you so much for those insightful answers. And you are listening to POV Austin at KAZI 88.7 FM. I'm Riley, and I'll be back shortly to discuss the interview. Welcome back to POV Austin on KAZI 88.7 FM. I'm Riley, and your host for POV Austin, and joining me is a very, very special guest and former host and founder of POV Austin, Maya. Hey.
Hey.
Welcome back, and thank you so much for joining us today.
It's great to be back.
So that was a wonderful interview. I am
Definitely
so grateful I had the opportunity to talk to Dr. Larry Wallace today. So he talked a lot about how the Black Men's Health Clinic coordinates and navigating health services for communities and individuals. And I think what he was saying about being culturally specific is really important, and being able to be on someone's level and communicate to them in a way where they feel safe and comfortable expressing their health and their needs.
Yeah, I definitely agree. And it's really important to bring that perspective into healthcare, and especially in mental health, where there's kind of a lot of stigma around talking about it, especially in the Black community. And so it's important to have people paving the path to bring that cultural awareness and just spotlighting the importance of that in these industries where you don't normally see that kind of variety and emphasis on those key factors that are really important.